And when you hear someone say all-inclusive care, do you really know what that means? The people at InnovAge PACE sure do. Their team provides a robust package of care and support 24/7, 365 days a year. And here to tell us all about it in this sponsored segment is Gabriel Silversmith, InnovAge PACE's State Medical Director, and he's here to share more. Welcome to the show.
Thank you so much.
Yes, and first off, not everyone knows what all-inclusive care means. So how would you describe it?
Well, when older adults start to need a little bit extra help to continue living at home, that's where we step in. We provide whatever they need, whether it's help at home, transportation, fun times with friends at our centers, medical care, social services, whatever it is, we've got you covered. From really the time you wake up in the morning until the time you go to sleep at night, and even after bedtime.
It's so important, and I'm glad you mentioned after bedtime, because when the care facility closes, what happens then?
Right. We provide 24-hour care, 365 days of the year. That's really what we need to do to meet the needs of our participants. And so like, let's say you're a participant in the program. You wake up in the middle of the night, you're feeling feverish, it hurts to pee, you don't know what to do, you call us. A nurse picks up the phone and kind of walks through what's going on with you, makes a plan with you that's going to meet your needs. In this case, we'd send out a registered nurse right away to your home. We call those people visiting after-hours nurses. It's their whole job to do these urgent visits after hours. Weekends, holidays, whenever it is, middle of the night.
That's fantastic.
So the nurse would come to your home, take your vital signs, do a physical exam, test your urine, and then talk with the physician on call and make a plan, whatever that is. In this case, it might be we send out antibiotic stat to your home to treat you.
That is so important. I want to hear more from you in just a moment. But first, we had a chance to catch up with one of your nurses, after-hour nurses, and she's here to show us how it works. Check it out.
It is such a reassurance to my mom, because at this age, she can wake up in the morning and not feel quite right. And then she starts worrying about it. And that can escalate. And the more you worry, the worse you feel.
It's a lot of coordination, and there's a lot of good communication at InnovAge, because a lot of times, like, I communicate to them what I see in the home, and then they're able to order different tests or different things they need to do right away, and then it's something that we can bring up in a morning meeting and collaborate together. That way the patient care is almost immediate.
It's a good feeling to know that you're taken care of. It really is.
All of her professionals had access to her chart where they weren't guessing what was going on with this aspect. And I think that is such a huge plus. When I have the opportunity to tell others about that, that is one of the things I share. And just the fact that everybody that I ever encountered that worked for InnovAge at the center, or you guys, or other folks that have come in, everyone is just so professional yet so personable that it's amazing.
Well, that's amazing, and we see how your help after hours really works with seniors, but it goes beyond that.
That's right. That's right. Nobody wants to go to the ER to get care. To wait around for hours, get poked and prodded, have a machine beep at you.
Yeah, that's true.
It's just a terrible experience that people don't want to have to go through, let alone older adults. Folks with dementia, they can get confused and agitated. You're attached with wires and tubes that you can trip and fall.
It's uncomfortable
over.
And scary.
That's right. Not to mention the cost. It's a very expensive place to get care, and that cost falls on patients and it falls on society as a whole. We want to get ahead of that. We want to meet people's needs before they have to go to the ER.
Now, Gabriel, the acronym is VANS. Are they unique to the program?
Yes. Visiting after-hours nurses is something that InnovAge developed. It's really not a standard part of PACE services. We listened to our participants. They were telling us, we need this, and we stepped forward to make it happen.
And you've been an integral part of this development of this entire program, haven't you?
That's right. Yeah, it's been tremendously gratifying to see it come to fruition. As you can imagine, we had to hire a whole slew of nurses to get this off the ground. And that's not easy to do.
Right.
It wouldn't have been possible without the will of the organization behind this, seeing the needs and being willing to meet them.
Thank you so much for coming on the show, giving us a sneak peek and helping the seniors. It's so important. The InnovAge team is happy to help you evaluate your options, see if you are eligible for the program, and share more on how PACE can fit your particular healthcare needs. If you'd like to learn more, reach out to InnovAge's center staff in your area. They're happy to give you and your loved ones a tour. You can also visit their website. Go to innovage.com for more information. And again, Gabriel, thanks for coming in, and thank you to InnovAge PACE for sponsoring this segment.